Hi, agents. This is Captain Herzon with today's recording on for May the 3rd and 4th. Our lesson objective is patterns in dental structure and development. and um, right now, you see um, uh, dentition charts for both the primary and the permanent teeth. I'll go into this a little bit more, but I just wanted to get rolling on uh, discussing um, patterns in dental structure and development, so you know where it's coming from and what we're going to be doing in class today as well as on Thursday and Friday. Okay, so why do teeth have such a high forensic value? And I just wanted to come out and say, a disclaimer that we're not going to be covering anything. I'm not going to discuss bite mark analysis because in most states in the US, um, bite mark analysis is considered um, um, to be uh, um, to have to have no scientific basis to it. Um, there has been no scientific studies done on um, on population statistics on how uh, the probability that a particular person has made a bite mark compared to anybody else. So if you remember on the probability scale from 0 to 1, okay, um, there's a very the only high chance you have is having a high chance of being wrong. Okay, it's um, um, it very likely that it can pertain to a very large group of people. Okay, so there's been no scientific investigation on bite mark analysis. Okay, and in Maryland courts now, it's bite mark analysis um, is cannot be submitted as evidence in a court of law in a forensic investigation. Okay. Okay. So, um, two reasons why teeth have such a high forensic value. Um, Anatomically and structurally speaking, what makes teeth so valuable is unlike any other tissue that's in the human body, the enamel component is very durable. Okay. It will never degrade, it will never become desiccated. All right. It can be in water for long periods of time and never change. Okay. And if there were any, um, fillings that were in the enamel, okay, those would be, you know, of maybe even more recent dental amalgam. Those have withstand the change in time. And I think you've seen some of the pictures, um, even in ancient times, um, um, remains of individuals, whereas the bone has become a little bit more desiccated, but the tooth is intact, especially the enamel. Okay, and the other another reason for that is that it has a high value in terms of genetic material. Teeth are a great source for DNA, and all of the cellular tissue is inside of the dental pulp of the tooth. And even if the tooth is crushed, it still can provide access to nuclear or mitochondrial DNA for identification purposes. Okay, so really, those are like the two big reasons why they have such a high forensic value. Okay, now in terms of application in forensics, okay, why is it that we can apply or what sort of applications can we make uh, to dental remains? Okay, so the one there's just a couple. One is that teeth follow a pattern in development. The primary dentition are um, those erupt and then fall out during a certain time period. Okay. And then they're replaced by the permanent ones. Okay. Even the number of teeth change over time as a person develops. Okay. Quantitative measurements help establish a relative age of a person because we know the ages of a person when teeth erupt, when the primary teeth fall out. Okay. And so these eruption charts for primary and permanent teeth are needed to estimate the relative age. Okay. And this is what we're going to learn about today and also Thursday and Friday. Next week, we'll take a look at the second application. Each individual has their own set. This makes them ideal for tracing to dental records to find missing individuals or even matching dental remains to individuals. So if you have a case in which maybe a small plane or even a jet liner crashes and um, 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 there's a high probability on the manifest list, okay, the names of the individuals, and then it's a real laborious process of finding dental records for each of the passengers along with the flight crew. Okay. And so once that they get those dental records, those are called antemortem records during their lifetime. Okay. So they would have like a complete set of x rays. And this is going to be something that you're going to be going into. It's really, really terrific, really neat, and can give you like a real sense what goes on in forensic investigations with dental remains. Okay, so what they would do is now take dental X-rays of the of the remains of the individual recovered from the crash site, and then start trying to match up um, um, the uh, the dentition in the postmortem X-rays with the antemortem X-rays, and we have one culminating activity for you this year, especially for the seniors. Okay, in which you physically are going to be looking at um, um, postmortem X-rays of just individual teeth. Okay, and looking at um, antemortem X-rays and try to identify not only which individual does that tooth belong to, but which tooth it is. Okay, and where it goes in their place. Is it a part of their mandibular part of the mandibular arch, or is it the maxillary arch, and then what type of tooth it is. Okay, so knowing you would get it right down to the actual. If this is an adult, okay, which tooth number it is. So it's really kind of exciting, and makes the whole. It really does make the whole assessment um, um, kind of like you're so on task with it, you for and you want to make these matches so much you forget, you really forget that it's for a grade, because it's so intriguing and so hands-on and applicable to what goes on in forensic investigations today. Okay, so like I said, this week the objective is um, to notice how teeth follow a pattern in development. Okay, and we're going to go right back to these dental charts, um, in which you see the timeline of when the primary teeth, or also known as the milk teeth or the baby teeth, the timeline that they erupt, and one of the first teeth that actually erupts, as I'll just use my mouse cursor as a pointer. Okay, it's the central incisors of the maxillary arch. Okay, those come in first as early as 6 months of age to 10 months. Okay, and then you could see that the central incisors and then the lateral incisors of the maxillary teeth come in next. Okay, and you'll notice the time they stay in the mouth, um, um, and for a number of years. Okay, the first ones to shed are kind of like the first ones that have erupted. So it's the central incisors are the first ones to fall out, and which is a big moment, for every child, um, and even the parents. And oh, okay, we can say big news for the tooth fairy too. Okay, um, and uh, s- um, um, the it's usually the second molars that last the longest, as well as the canines. Okay, are some of the last ones to fall out. And by comparison, you can see the number of teeth. I'm sorry, this image is not to scale, um, actually to the primary dentition scale. I shrank it down a little bit, okay? But the reason why the canines and the second molars take um, take a longer time to actually shed is because more teeth are going to be developing. Okay, and if you notice and recall that in the primary dentition there are no premolars. Okay, only incisors, canines, and molars, no premolars. And you can see in the permanent dentition, we don't just have one premolar, we have two, the first and the second. So um, everything is changing in terms of um, the number of teeth, plus, all right, growth and development of the maxillary bone as well as the mandibular bone, the bones that make up the jaw. Okay. Um, the other thing um, that I will be pointing out is the growth of the type of bone that lead into the development of the teeth. Um, um, this part of the mandible right here, okay, um, there is a different type of bone that's located right um, right along your gum lines, okay, for your mandibular teeth and your maxillary teeth, okay. Um, in the gums is what's known as alveolar bone, okay. It's uh, I'll get into the uh, anatomical structure of that in a moment, okay. But the first thing that I want to do is uh, just go through the different types of teeth that there are in the permanent set. So remember, we have both the central and the lateral incisors, the canines, um, in the numbering of these teeth, okay, um, in which their um, numbers are used to describe um, um, the posterior teeth in terms of the first molar, I'm sorry, the first premolar and the second premolar. If you notice, the incisors, um, those are part of the anterior teeth. They're um, um, there's an adjective, okay, placed in front of the word incisor. So we have the central incisor, okay, and then the lateral incisor. And then we would have the canine, okay. Now in the posterior teeth, we would have the first premolar that's right behind the canine, and then the second premolar, okay. And you can see that the second premolar is actually bigger. It almost is the size of one of the molars. There's just not many cusps on the occlusal side of the tooth, okay? And we'll be getting into that a little bit more next week, okay? More with those dental terms that you learned last week, okay? And then for the molars, we would have the first molar, the second molar, and then the third molar, okay? So here's what I want you to do, okay? I want you to zero in and look at the molars. And I know that, and we did this in class. So in the chat, describe a pattern in the structure, okay? And just asking in the structure of these maxillary molars and then these mandibular molars, okay? And the one thing that everyone noticed was that there was a difference in the roots for both of these molars. Okay. Um, the maxillary molars have trifurcated roots, a set of three roots. Okay. Notice how one is positioned towards the back, which is posterior, and then two of them are facing out the front, um, which would be um, not facial, okay, because the molars are on the side. They're actually facing the cheek, so that would be uh, the term buccal, okay, all right. So that they have three roots, and this is going to be really important in terms of if you have a molar, one the only way the fastest way that you can identify is it a maxillary molar or is it a mandibular molar is just by looking at the roots, because the mandibular molars have bifurcated roots, okay. So that's something quick and easy to point out in the identification process as to um, um, where the tooth actually sets in the mouth. And then you have to go through the task of saying, well, is it the first, the second, or the third a molar? Okay. Okay. Now here's where we're going to have a little bit of anatomy lesson, um, and this has to do you, with a lot of concepts involved. And what I'm referring to is that, through evolution, there's been changes in the anatomy of bone um, in our species, as well as there's genetics at play as well. Okay. And then, we can look at the anatomical structure as well, to note how um, 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 what sort of um, development that there is in the dentition. Okay, it's something that dentists think about. Okay, but in terms of forensics, it makes a little bit more sense if you're like ever wondering, well, why is it that the molars in the maxillary teeth have three roots, and why do the molars in the mandible have only two? Okay, so there is some discussions and readings that many dentists and forensic investigators have made, and some it says, oh well, it's kind of based upon evolutionary development or maybe genetical development. But the one that I find the best is looking at the anatomical reasons. Okay, so here we have the skull, okay, and using my cursor, I'm going to be showing you um, um, one primary bone, and that's called the maxillary bone. Okay, now there is the nasal spine right here. Okay, all right, and then these are separate types of bones here. Um, this is actually this thin part right here in the nasal cavity is called the vomer, okay, with a V, all right? And you'll notice the different sinuses that are that are in the skull as well, all right? And I want to bring special attention towards the maxillary sinuses. Okay, and those are like on the sides, right adjacent to your nostrils. Okay, and sometimes when you have infections, you'll feel this area pressured sometimes. Headaches, it's usually the frontal sinus. There's some congestion in there. Um, and with other types of sinusitis, the sphenoid sinuses are really inflamed, putting pressure on the skull. Um, but let's keep our focus on the maxillary sinus. Now, the reason why these sinuses have the names is due to its position um, inside, because they're inside of the bone. Okay, so the frontal sinuses are located within the frontal bone. Okay, same with the sphenoid. All right. The maxillary sinuses are located within the maxilla bone, okay, that I'll outline here. And you can see right here is a suture. And what a suture is, okay, it's where one bone um, joins a different bone and they become fused together over a period of time. Okay. So the maxilla, all right, is outlined here by my cursor. Okay. And then a structure or a protrusion that sticks out of bone is called a process. Okay. And that's where the dentition comes into play. So there is a type, this process that develops here is called the alveolar process. And it's just referring to your um, um, the upper part of the jaw and the lower part of the jaw. Okay. All right. And then there are some other processes, more so in the mandibular, the mandible. Okay. So here is a lateral view of of the alveolar process. Okay. And now we can look at um, the types of bone that make up this process. There are in the human skeleton, there's two um, major parts of bone. Okay, the one that gives bone its structural endurance or strength is what's known as the cortical or the compact bone. Okay, and you can see here there is like a thin layer of compact bone, all right, that surrounds um, the entire bone, okay, giving it a little bit more strength. Probably the one bone in your body that has the greatest amount of compact bone um, are the bones that are within your legs and within your arms, okay. Um, Trabecular or spongy bone, okay, this is where all the the living cells are located, called osteocytes. Um, mm, um, the compact bone is primarily made of a mineral composition. Okay, um, not there are some osteocytes um, uh, alive in there, but not as many as the trabecular or spongy bone. Okay, and what this does is forms the alveolar socket, and this is where the tooth actually develops from. Okay, now by contrast, um, the mandible also has an alveolar process. Okay, and what I mean by alveolar process, I guess the best way to describe it is if you can imagine your gums, all right, for your upper and your lower jaw, okay. Um, um, the alveolar bone is located within the gums. So if we were, um, to remove the gums, we would have a perfect view of um, this alveolar bone. Okay, and I've shown in class um, holding the skull, and I don't think I have one here. Hold on. Oh, there's good news. I don't have just any skull. Okay, it's synthetic. It's not real. Don't worry about it. Um, but you can see that all the bone is colored, okay, to show you the location, okay? And if you can see that this yellow color right here, this is the maxilla bone, okay? All right. And this white part right here is what makes up the mandible, okay? So when we talk about um, the alveolar process, when we're looking here um, for um, the maxillary, okay, that alveolar process runs across here where my finger is. And then for the mandible, okay, it runs across right here, okay? And this is where that alveolar bone um, is located, all right? So I like this picture right here, this lateral view of the mandible, all right? You can see the cortical or the compact bone, okay, that makes up um, that outlines the perimeter of the entire mandible. And then you have the spongy, or um, it's called trabecular, or even cancellous. Oh my God, they have so many different names for the same types of bones. Um, you know, you can drive yourself silly trying to remember all the ones, but I'm not holding you accountable, okay, for all the different names, okay, of these bones, okay. I'm doing this to show you, all right, um, for the simple reason of why maxillary teeth, maxillary molars have three bones, three roots versus two roots in the mandibular molars. Okay, so one thing that I hope you can notice here is the thickness of this compact bone in the mandible. Okay, do you notice that? And if we go back, all right, how much thinner this compact bone is by contrast in the maxilla. So we know that this is an incisor right here. If you can imagine um, a molar, okay, um, there's not a lot of space um, in which um, the roots can actually seek in. And what I mean by space is length. You know, look at the length of the root. Okay, and look at the length of the root in the mandible. They're a little bit longer. Okay, so they're planted more firmly in the mandible than in the maxilla. Okay, and there's actually a real danger. Okay, um, if there is an injury to the maxillary bone, um, the real problem that they're going to look at is how close those roots are of the mandible to this maxillary sinus, because it can actually puncture through, and then you would just get a horrific infection um, within that sinus. That's really, really difficult to actually um, fight against. And you would be probably hospitalized with a lot of serious antibiotics. Okay. Um, but it would be kind of dreadful. Okay. So there's not a lot of space. So to compensate for that, we have an additional root to keep it firmly in place. Okay. All right. A pattern. All right. Remember, I mentioned that there is patterns in the timeline of when the primary teeth develop, erupt, and then fall out, and then when the permanent teeth come in. There's also a pattern in the anatomical structure between primary and permanent uh, teeth within the same type of tooth. Okay, so here we have two molars. Okay, and it's the one on the left is a primary molar, and the one on the right is a permanent molar. Now take a look at the roots. How many roots do they have? Okay, because the question is, are these maxillary molars or are they mandibular molars? Okay, so taking what you just learned about trifurcated roots and bifurcated roots, these would be mandibular molars. Isn't that neat? You've already increased your knowledge and understanding um, of a dental tissue um, real quickly by just being able to recognize if molars are from the upper part of the jaw versus the lower part. So now you've actually can really have entertaining discussions with your dentist, and I think your dentist would be really pleased, you know, um, uh, to know that you know about this. Okay, at such an early age, even before your college studies. Okay, but do you now when I talk about patterns, these patterns could be in as a way to compare um, 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 one variable to another variable, okay? In which here we would have primary versus permanent, okay? And we could see similarities in patterns of development, okay? But when we see differences, those are even more remarkable, and we remember those a lot more than similarities. Okay. Um, it's kind of like a discussion, that you could have with friends in which you all had pizza for dinner on the same night. Okay. That's not really remarkable. What may be more remarkable is which ones had vegetarian type of pizza versus having meats on their pizza. Okay, that's something that you would remember a little bit more. Okay, so a couple things about, and actually three things. Uh, the way to know um, primary versus permanent teeth, and that is to look at the actual crown of um, the teeth. Primary, they're really glossy white color, while as in the permanent, it's kind of like a tinge of yellow. Okay, um, that's one noticeable difference. But I think what really stands out that you can see um, is the thickness or the width of the roots, and also um, the gap between the roots. Okay, so when you look at the primary um, uh, teeth, the primary molars, look how far apart those are and how much closer together they are in the permanent molar. And do you also notice how much wider or thicker the actual roots are in the permanent set? Okay. All right. Now, the reason why there is a larger gap between the roots and the primary molars is because that's going to be the area that the crown or the enamel of the developing permanent molar is taking place. Okay. So, right within this area, right here, is where um, this part of the crown of the permanent tooth actually develops. Okay. And you guessed it, as it develops, okay, it is going to start pushing this primary tooth out of the alveolar bone, okay, and out of the gum line until it falls out. Okay, I think this is really really neat because if I showed you an X-ray, okay, um, um, we can see right away. All right, we're looking more posterior. Okay, all right. So we're looking at the dentition, the teeth that are posterior, and in the permanent set, all right, this would be the premolars and the molars, okay, but we've got some primary teeth here as well as permanent teeth. So you can see this one right here is a permanent tooth. This is actually the first molar that has recently, um, erupted. You can see right here the second molar hasn't fully erupted yet. Okay, and what's interesting is we can go back to our dental chart. Okay, these second molars usually erupt between the ages of 12 and 13. Okay, so now when we look at this X-ray, maybe this person, their 12th birthday is coming soon. So we might be looking at a person who's like age 9, 10, or 11. Okay. Because we also can look and say, okay, well, the first molar has come out and they erupt age 6 to 7. So maybe it looks like that molar has been around for at least a year, and that's why it's better to give a range than an exact year. Okay, um, because there are anomalies, and it's a lot better when you say giving an age estimation. All forensic odontologists will give a range, and sometimes, as a person gets older in their permanent set, the wider that range actually gets. Okay, but evidence of primary teeth and recent eruptions, um, that age range narrows a little bit. Okay, so here you can see a new permanent tooth coming in, and you can see how the crown is developing within that wide arch. This is actually not just a primary tooth, okay, but it's a molar, all right, and it just happens to be the second molar, okay, right here, of the primary dentition, okay, and you can see within, and we know we're looking at the mandible, all right. Um, I know the teeth would be hanging down if they were maxillary, but you can instinctively know right away because when you look at the molars, there's only two roots. If we were looking at the maxillary, there would probably be three roots. Okay, all right. Um, but this is really helpful to actually see the pattern in development and how we can use those eruption charts to estimate a person's age. It's really, really cool. Okay. So here we are towards the end. Um, See if you can solve these questions. Okay. So here we have an x ray of a tooth, okay? And we're identifying it, it's a molar, okay? Now, is it a maxillary or a mandibular molar? Think about the number of roots, okay? And that will lead you to the correct answer, okay? And if you're thinking maxillary molar, you would be correct, okay? Now, is this a primary tooth or is it a permanent tooth? And again, okay, we can't see glossiness, we can't see the structure of the crown too well, but the one thing that you can see um, is the thickness or the width of those roots. And remember the gap, all right? So there is evidence of a gap, and that means that this is a primary tooth. Okay, so I hope this whets your appetite a lot, and maybe you can't wait, to actually do more. We'll be looking. Um, this is going to be one of my openers, looking at this individual's X-ray. It's called a panoramic X-ray, in which the the X-ray is taken by actually moving in front of your entire mouth, okay? And that way it appears that, you know, it's kind of like if you think about a pumpkin, that you see that a person smiles and you see every single tooth, okay, in the smile. Of course, this is not true, okay? But we're able to, in these panoramic visions, we're actually able to see all the teeth all at once. And so think about this. And until next time, this is Captain Herzon on this special day in which I can say, May the 4th be with you. So here we go. May the 4th, okay, the letter M, May the 4th be with you. Have a great day.